It's okay, sweetie. They're gonna call us soon. They're gonna help you feel better. I'm sorry.
JJ? Hey guys, how are you guys doing today?
Good. How are you?
Good. My name is Allie. I'm a PA student. Is it okay if I take your daughter's history and physical?
Sure.
Okay, great. So what brings you guys in today?
My daughter has a really bad cough.
Okay, I'm sorry to hear about that. When did that start?
The cough started about 2 days ago.
2 days ago? Okay. Were there any symptoms that presented or anything that happened in particular before the cough started?
She had a cold for about a week,
Okay.
but this cough is different. Like, it's definitely worse.
Alright, so I'm just gonna go ahead and just start a physical on her, and then I'll go speak with my preceptor and we'll both come back in, okay?
Okay.
Alright. Alright, so I'm gonna go ahead and just talk to my preceptor, and then we'll come back and discuss the treatment options for her, okay?
Okay. Thank you.
Hey Dominique, can I just talk to you real quick about this patient I just saw?
Yeah, sure.
Okay, so we brought in a 2-year-old female who came with her mom with a complaint of constant moderate coughing the last 2 days. The mom says that the cough has been harsh and barky, and it started a week prior with just cold symptoms, and then it progressed to the cough that she has now.
Okay.
There hasn't been any sputum discharge. They do say that there was congestion, and the mom's worried because she thinks the daughter's having trouble breathing.
Okay.
The patient did have a recent sick contact at daycare. They don't know what the kids had though, and there are 20 kids in the daycare.
Okay.
Yeah. She also reports a decrease in appetite, saying limited to like just soft foods and liquid diet. The patient also is fatigued. The mom denies choking, vomiting, diarrhea, drooling, wheezing, ear pain, facial pain, foul smelling breath, rash or sore throat.
Okay.
For the patient's past medical history, she had a right otitis media. About when she was 18 months, it was treated with amoxicillin. The patient was born premature at 36 weeks, but no other health complications with that.
Okay.
There was no family history of asthma or croup. The dad does smoke, but mom says he smokes outside of the house. For vaccinations, the kid is up to date with all of her vaccinations besides flu, and both parents, they are not vaccinated for COVID or flu.
Okay.
There's no medications or allergies reported. So she also denied chills and sweats and any chest pain. So for her vitals, she had a fever of a low grade of 101.3. She's tachycardic and tachypnic at rest, and her O2 stat is 96 on room air. General survey, she is distressed and looks a little lethargic. For skin exam, it was normal, no cyanosis noted, head normal cephalic, ears were clear bilaterally. There was acute inflammation on the nasal mucosa when I looked inside with mild rhinorrhea. The mouth and throat were within normal limits, neck was within normal limits, no lymphadenopathy noted. On auscultation, she had normal rhythm, but had mild tachycardia. Normal S1 and S2 was auscultated. Respiratory, she does have mild intercostal retractions and accessory muscle use.
Okay.
And then when I auscultated, I did notice inspiratory stridor at rest, but no audible wheezing, rhonchi, or grills. I also did a GI exam, and that was within normal limit. I'm kind of thinking croup, and I was thinking some differentials could be like epiglottitis or maybe a foreign body.
Okay.
aspirated.
Yeah, that sounds about good to me. We can also potentially just rule out RSV and, you know, COVID, things of that sort too, just
Yeah.
to be sure. That
So-
sounds fine.
Probably like a COVID, RSV, and flu
Mm-hmm.
rapid.
Yeah, let's also do a CBC,
Mhm.
just to rule out any infection maybe. And then we'll need to get an x-ray if we're thinking that this could be croup. Presentation makes sense, but let's just be sure.
Yeah.
So we can rule that in or out.
Okay.
Okay, and you said she's 2?
She is too.
Okay. Poor
And
thing.
yeah, she does look pretty bad. So.
Okay. All right, so go ahead and order those tests then,
Mhm.
and then once we get those back, I'll go ahead and talk to them.
Okay, I'll let them know. Okay.
Okay, perfect, thank you.
All right, guys. So I just spoke with my preceptor, and we decided to order a CBC. We're gonna rule out RSV, COVID, and flu with a swab, and we're also gonna get her an X-ray. We are thinking it's most likely croup, but there's also some other differentials we just want to rule out first before we go ahead and start the treatments. Okay.
Okay, what's a CBC?
So it's a complete blood count. We're just looking for any signs of infection, really.
Okay, and it's blood work?
It is blood work, yes.
Okay,
Yeah.
okay.
It should be.
We'll work through it.
Yeah. We'll figure it out.
Okay,
So the results are back for that the coughing patient,
Okay.
the 2-year-old. So everything was negative. The COVID, flu, and RSV were all negative. The CBC was within normal limits. The only thing that had any indication of an illness would have been the X-ray, which showed inflammation.
Okay,
Pretty classic steeple sign.
okay.
So I'm definitely thinking it's croup.
Okay, that sounds good. So what I will do then is I'll go ahead and talk to them about the results, and then I'll talk to them. What do you want to do about treatment? What are you thinking?
Yeah, so I'm thinking we should definitely do a nebulized racemic epi,
Okay,
and then dexamethasone. I think just 1 dose would be fine, and then monitor. I think about 4 hours, just make sure that she is doing well and improving.
okay. Because they had the stridor, the
Mhm.
retractions, and the accessory muscles, so we're thinking what, like a
Definitely moderate, yeah.
moderate group? Okay,
Yeah.
yeah, that sounds within alignment for moderate group for the treatment. That's fine with me. So I will go ahead and I'll go talk to them about the
Okay.
labs. I'll talk to them about treatment, and then I'll let them know that we'll just go ahead and watch her for a couple of hours to make sure that treatment is working.
Okay. Yep.
Alrighty, thank you so much.
Of course, thank you.
hi guys. Hi.
How are you?
We're doing okay.
Good. My name is Dominique. I'm the physician assistant that's helping Allie, okay? So we did do your labs. We did the COVID and the flu, and both were negative. We also did the RSV, and that was also negative.
Okay.
We checked the blood work. Those were within normal limits, but the x-ray did show some inflammation of her airway. So we're thinking that this might be croup,
Okay.
which is common in the winter months. And given her presentation, that's most likely what it is.
Okay.
So what we're gonna do is we're gonna go ahead and we are going to give her racemic epi, which is just a nebulizing treatment that should work within 30 minutes to kind of help some of these symptoms here. We're also gonna do an oral steroid called dexamethasone, and that should help with some of the inflammation over the next couple of days. And then while she's here, we're just gonna wanna observe her for the next couple hours, probably about 4 hours or so, just to make sure that she's doing okay. In the event that she isn't improving with these medications, we would have to admit her to the hospital. We just want to watch her for a little bit, just to make sure she's doing okay. All right?
Okay. Thank
Okay.
you.
Do you have any questions?
I don't think so. I guess you guys will be coming back to check. and
Yeah,
see
we're
if she's-
we're gonna come back in and check with
Okay.
her after we give her the medications, just to make sure she's doing okay.
Okay.
Alrighty. All right. We'll get her taken care of. Just give us one moment.
Okay. Thank you. Come in.
Okay, hey guys. All right, so after observation, she looks pretty okay. She's doing well on the treatment. Okay, so she is good to go home. We don't have to admit her. I just want to discuss some important educational points before you guys go. So we already talked about what croup is and how she might have contracted it. The symptoms should improve within 3 to 4 days after the treatment that we've
Okay.
initiated. So over the next couple of days, she still may have some coughing and stuff, but it should subside after about
Okay.
3 or 4 days. you can use Tylenol or ibuprofen to help with her fever. And then we just want to keep her well rested and hydrated, okay? Just to, again, help with these symptoms and help with that fever.
Okay.
So to just maintain comfort, it is important for her to just continue normal breathing, and then just keeping her in an upright position. If she is having trouble breathing, that could help a bit too.
Okay.
If the cough or the shortness of breath does recur or it does persist, you can try like a hot shower. Just the mist of that shower might help. Or going outside, cool air could also help relieve those symptoms too.
Okay.
Additionally, you did say she wasn't vaccinated for the flu. However, that will be important just to reduce future occurrences, as one of the main causes is the parainfluenza virus.
Okay.
And so if we get her vaccinated, then we could reduce this recurrence, okay? We want her to follow up in about 2 to 3 days with her primary care just to make sure that everything's going okay.
Sure.
And then if this does worsen or if it does recur with these same symptoms, so the labored breathing, the stridor, the wheezing, even cyanosis, the blue coloration of her skin, then we want her to come back to the emergency room, okay? Alrighty, do you guys have any other questions?
I don't think so. Thank you guys very much.
Oh, you're very welcome. Okay, so again, if she does have any problems moving forward, reach out to primary care, and if it's really intense, then just come back, okay?
Okay.
Alrighty, you guys have a great day.
Thank you.
You're welcome.